As we approach the start of the school year, we want to make sure school administrators know what to do when a case of COVID-19 is identified in a school setting. This webinar is meant to be reviewed with the recommendations for pre-K to 12 schools following identification of a confirmed case of COVID-19 released by the Department of Health and the Pennsylvania Department of Education on August 13th. We hope this information is helpful for our school leaders. Public health staff is responsible for case investigation and contact tracing for every case of COVID-19, regardless of the level of community transmission or number of cases identified in a school setting. Refer to the Department of Health's contact tracing frequently asked questions for a complete overview of the case investigation and contact tracing process. Cases are people who have been infected with the virus that causes COVID-19. Cases are directed by public health staff to isolate, which means they are asked to stay home in a hospital or care facility to ensure that they do not expose others to COVID-19. Individuals who are experiencing symptoms of COVID-19 should be immediately isolated while waiting for test results. Public health staff handle case investigation steps, including determining close contacts during the infectious period. Cases should stay isolated at home until 24 hours with no fever has passed, symptoms have improved, and at least 10 days have passed since symptoms first appeared. If the case has no symptoms, they should isolate until 10 days have passed since they were tested. Close contacts are determined by public health officials after a case interview. These are individuals who have been exposed within 6 feet distance for at least 15 consecutive minutes to someone who is a case during the infectious period, and it is unknown if the contact will go on to develop COVID-19. Public health staff determine close contacts after a case interview. In some school situations, it might be difficult to determine whether individuals are contacts or whether an entire cohort, classroom, or other group like an extracurricular activity member, might need to be considered exposed, particularly if people have spent time together indoors. Public health staff will work with school administrators to determine whether entire classrooms or other cohort groups need to be quarantined. Based on these discussions, public health staff will direct close contacts to quarantine for 14 days from the last exposure to the case. This includes household contacts, like siblings and parents, guardians, or caregivers who attend or work in other schools. Close contacts should stay quarantined at home until at least 14 days have passed since they were exposed to the case. For household members of a confirmed case, this could be at least 24 days since the case develops symptoms. The reason for that 24 days is because when a case can't separate themselves from the rest of their household, like parents and children, then the risk of the case infecting their household members is ongoing during their 10-day isolation period. Because of that ongoing exposure, the quarantine period for the healthy household members starts at the end of the case's 10-day isolation period. That quarantine period for the healthy household member is 14 days after the end of the case's 10-day isolation period, for a total of 24 days. An individual will be in isolation if they are diagnosed as a case of COVID-19 and are asked to stay home in a hospital or care facility to ensure they do not expose others to COVID-19. An individual should quarantine if they are at risk for contracting the virus. Quarantining is suggested for those traveling to and from areas with high positivity rates for COVID-19 or if they were in close contact with a confirmed COVID-19 case. Quarantine lasts 14 days to provide enough time for a full incubation period to pass. For cleaning and disinfection, schools should close off areas used by that sick person, including the classroom, bathrooms, or in buses. When open outside windows and doors, and wait 24 hours to clean if feasible. If not, wait as long as possible. This allows time for infectious material to become non-infectious and minimizes the risk to cleaning staff. Clean and disinfect all areas used by the person who is sick. That area can be opened once it's disinfected. And if it's been less than 7 days since the last exposure, additional cleaning is not needed and routine cleaning and disinfection should take place. Now that we've gone through some of the common terms defined, let's walk through what will happen when someone is identified as a case of COVID-19. There are many public health steps involved to identifying a case. First, a positive lab report comes to the Department of Health through the electronic surveillance system called PA-NEDS. A community health nurse contacts the case to do a case investigation. They determine the infectious period for the case and ask for close contacts. Remember, a close contact is someone who has been within 6 feet for at least 15 minutes during the infectious period. An epidemiology research associate notifies the school to provide guidance. And if more cases in the school are diagnosed, the associate will consult with the school. Contact tracers then start calling the case's close contacts and enroll them in a program that helps monitor their health. We will now walk through several scenarios that may occur during the school year when a case of COVID-19 is identified in the school setting. Again, these scenarios use recommendations for pre-K to 12 schools following identification of a confirmed case of COVID-19, released on August 13th. In this scenario, we're going to be talking about one student or staff within a 14-day period who is a case, and that there is a low community spread. In this scenario, a teacher is identified as a confirmed case. This is the first case in a school located in a county with a low level of community transmission. In this scenario, the case is the teacher. The teacher felt ill at school and went home immediately, saw their healthcare provider, and have been isolating awaiting test results. Public health staff at the Department of Health have completed the case investigation with the teacher, and they've learned about close contacts and symptoms and more. The teacher tested positive on September 10th. They taught until September 9th, and the symptoms started that day, and they've been home ever since. The contact tracing goes back to September 7th. That's 2 days prior to the symptom onset. Anyone who had close contact with the teacher from September 7th to 9th needs to quarantine at home for 14 days. This is the first confirmed case at the school, so public health staff tells the school it is not recommended or necessary to close the entire school. Public health staff discuss with school leaders and recommend the school clean all common areas where the case spent time. This includes the teacher's classroom, the teacher's lounge, and the lunchroom. The school closes off all areas used by the teacher and does not use those areas again until after cleaning and disinfecting. Once that's complete, the school continues with its chosen instruction model and reopens. In our next scenario, we are using within a 14-day period, 2 to 4 students or staff in the same school building that have tested positive and moderate community spread. A student gets sick on September 1st and is sent home from school and does not return. The student tests positive on September 4th. This is the third confirmed case at a school located in a community with moderate community transmission. Public health staff at the Department of Health complete the case investigation with the student and the student's parents and learn about the close contact symptoms and more. The student got sick on September 1st, was sent home and didn't return. They tested positive on September 4th. Contact tracers identify close contacts from August 30th to September 1st, including the classmates and teacher. Those close contacts are directed to quarantine for 14 days. This is the third confirmed case at the school within a 14-day period, so public health staff recommend the school closes for 5 to 7 calendar days to allow for a thorough investigation of the case for contact tracing and cleaning. Public health staff consult with the school leaders and recommend that the school clean all common areas where the students spend time. This includes several classrooms, the gym, and bus. The school closes off all of those areas used by the student and does not use those areas again until after cleaning and disinfecting have taken place. The school closes for the recommended time period and reopens with its chosen instructional model. What happens if a parent is positive? In this scenario, a parent of an elementary school student tests positive on September 1st. The parent has no symptoms, and no contact with anyone at the school aside from their child. The child and all siblings are excluded from school until at least September 25th. The parent is isolated until September 11th, and the child and siblings are quarantined for 14 days after. Many of the symptoms of COVID-19 also are common in other childhood illnesses like the common cold, the flu, or seasonal allergies. The overlap between COVID-19 symptoms with other common illnesses means that many people with symptoms of the virus may actually be ill with something else. It is likely that students and sometimes staff may present with these symptoms while at school. It's important to understand what to do in these situations, since some of these illnesses will not require the same public health response as COVID-19. It's important to note that notifying the department or county municipal health department staff is not necessary for symptomatic students, staff, and faculty, as other non-COVID-19 illnesses may be present with similar symptoms. School administrators should contact the Department of Health or County Municipal Health Department for further guidance if a parent, guardian, or caregiver notifies the school of potential exposure by a student, staff member, or school visitor. Refer to the Department of Health and Pennsylvania Department of Education flowchart for steps schools should take when a student or staff present with symptoms of COVID-19 but are not confirmed a case. Thank you very much for your time. The COVID-19 pandemic is constantly evolving, and continue to check the Department of Health and Department of Education websites for the most up-to-date information regarding COVID-19.